Hello everyone, I am Dr. Advait Kulkarni. So, potential complications of GBS or Guillain-Barré syndrome include respiratory failure. As we discussed, some of the patients after developing weakness in hands and legs, they may develop weakness of respiratory muscles where they face difficulty in breathing, and because of that they might need ventilatory support. About 30% patients might need a ventilatory support in case of GBS if not treated early. Next complication is autonomic dysfunction. Like patients may experience irregular heartbeats, irregular BP, which might need monitoring in ICU. Another rare complication is deep venous thrombosis. Because the patients are bedbound, they are prone for getting clots in their legs and the deeper veins of the legs, which can be prevented by giving some injections. And the last is the long-term disability. A few percentage of patients may take longer time to recover and will need intensive physiotherapy and occupational therapy for up to 2 years of the disease onset. So it's very important to diagnose GBS and treat it early as soon as possible to prevent these complications, which are preventable in most of the cases. Good news is, even if there are complications of GBS, the treatment is available in India as well as everywhere. With a good neurological support and ICU support, patients who experience a respiratory failure or a difficulty in breathing may need a use of ventilatory support or mechanical ventilation in case of severe breathing difficulty. Patients who are having autonomic symptoms, some of the medications and disease specific treatments are necessary, like involvement from a cardiology team might be needed. Patients who experience long-term disability, physical medicine and rehabilitation is very important. As discussed, if a patient develops a DVT, a deep vein thrombosis or clot in the leg, some injections are used to prevent and treat it. So, not to get scared, GBS is a treatable disease. With a proper neurological and ICU care, most of patients can improve fully. As discussed, GBS is a treatable disease, and looking at the varied symptoms of GBS, one might get scared. And there was a recent outbreak of GBS in Pune where 110 patients were diagnosed in various hospitals and are being treated. However, it's very important to understand that the exact mechanism of GBS is not known, although it is known to be an autoimmune disease. So, maintaining a good hygiene and preventing infections becomes very important because any respiratory or gastrointestinal infection can trigger GBS. Of course, how to increase your immunity so that you don't get these infections and you can prevent GBS. To improve immunity is very important to have a balanced diet. That is a local, traditional, seasonal food when you are hungry. Doing a regular exercise, a moderate exercise of 25 to 30 minutes daily, at least 5 days a week is very important. Following a good sleep hygiene, that is sleeping early by 10 o'clock, not to use mobile TV, having early dinner, following circadian rhythm, and sleeping by 10 o'clock, waking up by 6 or 6:30 is very important. Maintaining a good healthy mindset by practicing meditation, mindfulness, pranayama, and gratitude is very important to maintain a good immunity, which can help to prevent infections and subsequently prevent GBS. As we discussed, the patient who was admitted in ICU with me for more than 5 days and subsequently shifted to ward, with a proper treatment of IVIG, the patient recovered fully, and within 3 or 4 months of physiotherapy, he was able to walk and his joint is off his back and he is completely leading a normal life. So it's important to understand that GBS is a treatable disease, although the journey of GBS may vary from patient to patient. Some patients specifically who have a axonal variant of GBS, they may take longer time to recover and might need physical medicine and rehabilitation for as long as 6 months to 2 years. It's very important to undergo regular physiotherapy, occupational therapy, and engage the patient mentally and physically, keeping a positive mindset for faster recovery and treatment. In countries like UK and US, it is now more and more acknowledged that a personalized patient centered approach in treating this neurological condition is very important, along with a proper diet, nutrition, sleep hygiene, stress management, and mental well being. Continuation of physical medicine and rehabilitation exercises will lead to near complete recovery in most of the patients. The good news is More than 90% of patients recover fully, and those who are left with some disabilities may have a little bit of weakness in the hands and legs and a fatigue, but this can be prevented by early diagnosis and treatment. Thank you.